Similapuncture? Well, we're going to find out from Andreas Maier, who is a sports therapist, naturopath, and homeopath for the last 20 plus years. He is an educator and founder of Similapuncture, a new synthesis of homeopathy, acupuncture, reflexology, and other CAM therapies. I am Amita from Nourish Doc, a global platform from natural and holistic therapies. I'm super excited to introduce all of you to Andreas Maier, who's joining us from Germany. Welcome, Andreas.
Yeah, well, thank you, Amita, and welcome everybody to this little introduction to Similapuncture, which is a new way to combine homeopathy, acupuncture, reflexology, and other CAM therapies. Well, as Amita said, I'm homeopath for about 20 years now, which means I prescribe homeopathic remedies based on the principles from Hahnemann, Samuel Hahnemann, who was the founder of homeopathy. And the main principles is the law of similus, which means remedies are chosen according to the law of similus. Only remedies are given which in healthy persons can produce disease symptoms which they are about to heal. So in Similapuncture, I use this homeopathic remedy on a totally new way. The remedies are not given orally, like in usual homeopathic treatment, but the remedies are applied on the skin. And first, let's talk about the controversy in homeopathy about this application. Hahnemann, as I said, was the founder of homeopathy, and he, for a long time, cautioned his followers from local applications of homeopathic remedies. And in his textbook on homeopathy, The Organon of Medicine, he says that it's not useful either in acute or in local diseases of recent origin or in local affections that have already existed a long time to rub in or apply externally to the spot an external remedy, even though it be the specific. So that is the basis for homeopaths all over the world. They do not use homeopathic remedies because there is a danger of suppressing the symptoms. Hahnemann explains that when there is, for example, a skin eruption, and you rub in the remedy, homeopathic remedy or whatever, the eruption might disappear, but then the disease will show some internal symptoms. There might be some respiratory diseases like asthma or heart diseases, palpitations, and so on, or inflammations of the joints. We call this suppression. So the disease changes its level. The disease goes from the skin, from the external of the body, to the internal organs, and becomes more dangerous for the patient, and the health state of the patient is decreasing. So it seems obvious that homeopathic remedies should not be applied on the skin, but Hahnemann himself, he also found out after long years of experience that the cure of very old chronic diseases might be furthered by the physician if he applies externally the remedies or the same remedy which he gives internally and which shows itself curatively. So there are two opinions, and he's very spare in his instructions of how to apply the remedy externally. So he says we should rub it in the back or at the arms or extremities, the thigh or the lower leg, but he does not tell us how to do it. In fact, he says the patient should do this by himself. But there is a big advantage for therapists, for homeopaths, if they apply the remedies by themselves, I come to that point later if we talk about the advantages of Similapuncture. Well, in fact, today there are these two opinions. Should homeopaths apply the remedies externally, or should they not apply these remedies externally? Well, in fact, in my office or in any other offices, I guess in Germany or all over the world, most patients who are coming to be treated homeopathically, they suffer from chronic diseases. And as Hahnemann says, especially in the cure of very old chronic diseases, the local application of the remedy might enhance the healing process. So, but as his instructions are very spare, homeopaths have not saw this as an option and keep giving the remedies internally or orally, in the form of globules or tablets or drop doses and so on. Okay, please switch to the next slide. So, several years ago, about 15 years ago, I came to the so-called Weihe points. They are called Weihe points because of their founder. It was a German physician, August Weihe. August Weihe found out about special tender points or painful points on the surface of the body, and he found out that these points get tender or painful in relation to internal diseases. Weihe was, let me think, in the end of the 19th century that he found out this relationship, and he saw that in case of diseases, there are painful and tender spots on the surface on the body. And when he was a homeopath and physician, and when he treated his patients with homeopathy, not only the disease disappeared, but also the tenderness and the painfulness of the spots disappeared. And so he saw a relation between the painful spots and the disease on the one hand, and he could also refer painful spots and specific homeopathic remedies. So Weihe, in the late 19th century, was the first who found out about a relationship between homeopathy on the one hand and acupuncture on the other hand. Well, astonishingly, Maier didn't know anything about acupuncture. He just found out about these painful points. Today, with our knowledge of acupuncture, this is obvious. It's nothing new. But in Maier's time, there were no books available on acupuncture, and especially no books on Chinese philosophy. So we just found out about these points, and it was a French acupuncturist who later examined these Weihe points, and he compared them to acupuncture points. And he found out that the location of the Weihe points, Weihe described the location of his points, and the French acupuncturists could, who compared the location of the Weihe points, they found out that the location of the Weihe points was the same as location of acupuncture points. And so they started to inject homeopathic remedies into acupuncture points. And there are today many different therapies where homeopathic remedies are injected into acupuncture points. So there's already a synthesis between these different methods. Usually, there can be injected homeopathic remedies or herbal remedies. There are many different therapies called mesotherapy or biopuncture or homeosynergy, but it's about the injection of the remedies. In Similapuncture, we do not inject the remedies, We don't have to take specific preparations for injection, but we can rub in any homeopathic remedy which we use in our clinic. Because another principle of homeopathy is the use of single remedies. We do not use any combined remedies with several ingredients, but we use single remedies in different potencies. And in Similapuncture, other than in the other methods already mentioned, we can use any homeopathic remedy which we use in our practice. So, as we see here on this chart, for example, in acupuncture point bladder 19, there are 2 homeopathic remedies given, berberis and chelidonium, both liver remedies, and in fact, bladder 19 has a close relation to the liver and the gallbladder. So there is this relation between homeopathy and acupuncture, which is also shown in the use of the remedies at the specific points. And this is based on Maier's findings. So please switch to the next slide. Yeah, this is the instrument I use for Similapuncture. But I have to say that it doesn't matter if you use the so-called 7-star needle. You can use any other things, as we know that acupuncture points can be stimulated in many different ways. And Similapuncture is basically the stimulation of specific points on the surface of the body, and then the rubbing in of the remedy. The 7-star needle, as this instrument is called, or the dermal needle, is a little hammer with 7 needles on the top of the hammer, or the head of the hammer, which are star-shaped. And as you can see, these needles are comparatively thick, and they do not get deep into the tissues. They only perforate the surface of the skin. And by this perforation, the barrier of the skin is broken up, and then the remedy might act better. And there you keep on tapping the point. You do not prick in the needles. You keep on tapping the point, and the intensiveness of the tapping is should be yeah, even according to the sensitiveness of the patient. So the harder you tap, the greater or the bigger is the stimulus.
So I have a question. So the needle
yes,
you're
please.
using, 7 points, are they pretty, you don't use those needles, or you're using, you tap it? How do you tap it? With which direction? The other direction?
You tap these needles on.
Oh, tap the needles on the thing.
On the skin. Repeatedly, you tap it, and as I said before, the needles do not get deep into the tissue. It's just superficial. There's no bleeding. There's no injury of deep tissues, so there's no danger of injury of internal organs. Yeah.
What is the material this needle is made of? What is this material?
Steel needles.
Oh, they're steel needles. Okay.
Steel needles. Yeah. I don't know if they are available in gold or silver, and there usually are steel needles.
Okay.
Okay.
Should we move on to the next one?
Yeah, we can move on. So here's the advantages of the local application compared to homeopathy, but also compared to acupuncture. For me, as a homeopath, acupuncturists always had one big advantage. Patients are coming to the office and they get a real treatment. As a homeopath, I'm not allowed to give patients homeopathic remedies. I have to give them a prescription, and send them to the pharmacist. So patients come and talk, and they tell me about all the aspects of their disease. But I send them away. I have to send them away with a piece of paper in their hand. And it's an acupuncturist or a massage therapist or any other kind of manual therapist, you can work with your patient, and you can come in touch with the patient, and they feel right in your office that you did something, that you worked on them. And this is one great advantage, as I've seen in acupuncturists or in other therapists. And so in Similapuncture, we have this possibility to come in touch with the patient and apply the remedies by ourselves. A therapist can apply the remedy himself, first by the tapping of the needle, and then rubbing in the remedy with a cotton stick, for example, which means you take 2 globules or drops into a little bottle of water and then apply the remedy locally to that part. There is not no eruption coming on at that part. It's not irritating the skin. As we know, there is no chemically substance in this solution, so there's no danger of infection of the skin. It's just pure water which we use. So this is one advantage for the therapist. The patient comes to your office and you apply the remedy directly in your clinic.
Okay.
The other one, can you switch back? As Hahnemann said, the action of the remedy can be enhanced. And this is one very big advantage, as the patient often feels right after the treatment that something is working. You can say, hoppla, there's a feeling of warmth, there's a feeling of a little itching, it's a little tickling, or he says there's something working. You already feels the remedy working right after the application. And this is very special. You do not see this in homeopathy. I guess you see this in acupuncture regularly, but as I have to send the patient away with a piece of paper, so I do not see this usually in homeopathic clinics or offices. And other than in acupuncture, the action of the remedy continues for a very long time. You don't have to repeat this session every 2 or 3 days in the beginning, even in chronic diseases. We'll talk about a chronic cure later. You don't have to repeat this session every 2 or 3 days in the beginning and then switch to 1 week or 2 weeks. You can use this once and then wait for 2, 3, or 4 hours and see the remedy is working, still working. And you have a total control of the dosage and the repetition of the remedy. Usually when you send the patient, you send him home with this prescription, you tell him to take this remedy once a day or once a week, or just once, and then call back in 4 weeks. So you don't know really, is he keeping this, or does he change and say, oh no, it did not work yet, so I take it often, I take it hourly, or I take it 3 times a day. You cannot be sure. But with Similapuncture, you can be sure that he gets the remedy you apply to him, the dose and the repetition. Okay, so next slide. Next slide, please. Yeah, now we come to a case example, and it's very impressive. The next slide might be a little repulsive. It's the same leg. We have here the leg of a female patient who she was 81 years old. and she came to my office in a very reduced state of health. And as you can see, there is an ulcer at her left lower leg, and she had this ulcer for about 1 year. And the leg was steadily bandaged with different kinds of bandages, but it did not improve. So the first treatment, as you can see, was in the mid of June 2020. And after the examination, I prescribed, or I came to the conclusion that pulsatilla must be a possible remedy for her. Pulsatilla is an important homeopathic remedy for the treatment of ulcerations, but also of many different other diseases and symptoms. So I chose pulsatilla as a remedy, and then I made an examination of the patient, and I found that there's a very painful spot at the right shoulder blade, which is obviously in the liver region. It must not be an acupuncture point, but here, as we know, at the right shoulder blade, there's a region, a reflex zone for liver. And reflexologists might use this area when they stimulate it. They might stimulate the action of the liver. And there was a very painful and tender point right there. And I chose a very important acupuncture point, stomach 36. I guess acupuncturists know this point. And then I tapped the 7-star needle, as described before, at these 2 points. And afterwards, I applied pulsatilla. So please switch to the next slide. Here's another picture of this leg. And you might, as you will see, it's in a bad, bad state. And bloody, it's not suppurating, but these big scabs. Yeah, this was the leg before the patient came under my treatment. So the next slide.
Yeah.
The same leg 4 weeks, or 5 weeks after the first treatment. After two weeks after the first treatment, the patient came back to my office. We talked about the state of her leg and her general health. She came with many other problems. She had diabetes, digestive problems, some mental issues, and so on. But first we focused on the leg. Yeah, 2 weeks after the first therapy with pulsatilla, I made another application of another homeopathic remedy. And so as you can see, 5 years after the treatment, the leg is nearly cured. And the patient is still coming under treatment, but the leg is now totally perfect. So no need for any other treatment for the leg. However, her digestive symptoms are still there, and we're still working on some mental issues and so on. Okay, but this leg is after 2 times the treatment, and I guess the result is very impressive. And we have here this lasting effect from homeopathy combined with the instant effect from acupuncture. Okay, so patients often, they go out of the office and say, yeah, I can see this remedy is working. And this is one of the biggest advantages of Similapuncture. Okay. So here's the final conclusion. The effectiveness of any stimulation therapy, one can call acupuncture or homeopathy or reflexology, stimulation therapy, and the effectiveness depends on the choice of the optimal location, form of the stimulus, and intensity of the stimulus. The location as we've seen before, we can choose acupuncture points, we can choose trigger points, we can choose reflex areas, no matter where. The form and the intensity, the form here is in Similapuncture, the homeopathic remedy. We have to choose the Simile, which is called the homeopathic remedy according to the law of stimulus. And it depends on the intensity of the stimulus, which means the potency of the remedy and the intensity of the tapping. So this is the principle of Similapuncture, and this is the end of my presentation.
That's excellent. I think it's very interesting how you're combining, the topical, I guess, application of homeopathy medicines, right? And stimulating the points at the same time. So
Yes.
any questions? Any questions anyone has? This is just an introduction we wanted to do for what Similapuncture is. So if there are any questions from anyone who's attending in Zoom or audience, you're welcome to ask in the chat window. So this was because the leg that you showed while someone is thinking about a question, I just had a question. So it was because of the diabetes complication, right? The leg, what they call it is a diabetic leg, right? That the
Yeah.
case that you shared.
Yeah.
And just by stimulating the point that you talked about with the needle, and application of pulsatilla on that particular point 2 times, what I understood, and she was fine after 5 weeks. That's what I understood in the case study, right?
Yeah. Yeah, absolutely. I did not repeat pulsatilla the next time. I switched to another homeopathic remedy, but I did not want to go into the details here. But there was a slight aggravation at first. After her second visit, after the treatment, there was a slight aggravation, and this is this might be a good sign in homeopathy, as you can see that the organism is coming into reaction.
Yeah.
And there was this reaction, the slight aggravation, and I guess a second treatment would not be that necessary, would not have been that necessary, because I thought that the first remedy, pulsatilla, was still acting. So I chose a second remedy to complement the action of the first remedy, and but I guess that was not that necessary. We might have waited and wait and watch what happens next.
Sure. So let me ask you another question. Any questions, please feel free to put it in chat. I'm just asking a few clarifying questions, in fact. So the Similapuncture, is it readily practiced in Germany? Because I don't know. I'm not a practitioner. I'm just, I've been to acupuncturists, I've been to homeopaths, different, but so I'm just curious for our viewers, is this practiced quite common? Is it common in Germany?
No, absolutely not. I use this, and I founded this therapy, and I use it for about 2 years now. And I've experienced with some kinds of needling, and there is another way of needling. I don't know. Acupuncturists might know this, that you make a homeopathic solution and you dip in acupuncture needles and you just prick them slightly under the skin.
I see.
That's another kind of tapping. But Similapuncture is not yet used in Germany, and that's why I'm glad to have the opportunity here to introduce it.
Absolutely. And by the way, these are educational sessions, so please don't treat these sessions as medical advice. I think I didn't say that at the beginning. So we are trying to, introduce new things or new therapies or new techniques if someone is using in the world, to bring it out. So for educational purpose, it's very interesting. So Similapuncture is what, of course, you developed over the years of doing homeopathy and acupuncture. So let me ask you something. So let's say if someone is an acupuncturist and they want to do similar puncture, they'll have to study homeopathy. They'll have to understand, right, what homeopathy is, or and vice versa. A homeopath needs to understand acupuncture to do this. You can't just do it in isolation. You see what I'm saying?
Yeah, absolutely. Well, there is one main problem, which is you cannot, or it's very difficult to combine the Chinese philosophy with homeopathy or with our Western thinking of medicine. There's quite different understanding about the function of the organs, or pathology or things like that. And so this is very, very difficult to combine. And for homeopaths have to, I'm not an acupuncturist. I've done a lot of study courses during my education in acupuncture. In fact, I first wanted to start an acupuncture clinic, but then I decided to focus on homeopathy. And there are many similarities between these two methods. And one similarity is that there is the classical way, the classical approach, but there is also a clinical approach. If you see that acupuncture points, one acupuncture point might increase the blood flow to the liver, or increase the blood flow to pelvic organs, or lower blood pressure, or lower blood sugar, or relieve pain. These are clinical symptoms, not that based in traditional Chinese medicine. And this is there is something similar in homeopathy, where you can use homeopathic remedies on a clinical base. And acupuncturists who would like to use Similapuncture, they have the advantage that they know the acupuncture points, the exact location and the exact how they act, and what effect do they have on the organism. But they have to study homeopathic remedies, the action of the remedies.
That's right.
What Dr. Maier, Dr. Maier did, he did not use his points for therapeutic purposes, but just for diagnosis. So he, when a patient came into his office, and then he made the anamnesis, the homeopathic anamnesis, which is very exhaustive, and then he compared some painful spots if he had to choose between 2 or 3 different remedies, and he could not decide which remedy would best suit to his patient. Then he pressed some points and tried to find out if there's a tender point which indicates one specific remedy. So he just used this for diagnostic purposes, and with Similapuncture we can use this for therapeutic purposes too.
Yeah. No, I think, I cannot speak for all the acupuncturists, but at least few of the acupuncturists who've come on our program, they do combine homeopathy, at least in America. In US, I know quite a few acupuncturists already combine homeopathy, not in a way that you've described, but, I'm, like I said, I'm not an acupuncturist, I'm not a homeopath, but they do combine homeopathy with acupuncture, and I don't know all the details. So this is already, I think quite a few of them already do it, not in the same way, the way you described, with the instrument that you described with the 7 needles. So anyway, thank you so much for being on and educating us on Acupuncture. If there are any questions, we have our email and our website here. You're welcome to email us about feedback on the sessions and let us know how we are doing. With that, I'd like to thank you so much for joining us from Germany at this time. Thank you so much for being with us.
I thank you very much for the invitation. Goodbye.
Thank you. Bye-bye.